Now that we've slowed the spread of the virus, everybody wants to get back to normal. But we can't reopen the economy until we have more testing. Otherwise, we'll be right back where we started with a new outbreak that we can't control. At a minimum, we need to test the millions of people who want to come back to work. And then we need to keep testing them. We need contact tracing, so important when we get a flare-up. We can swiftly stamp it out then, which brings me to BioReference Laboratories. This is the largest full-service specialty laboratory in America. They had their first coronavirus test approved a month ago, and since then they've been ramping up testing in hotspots across the country. When New York and New Jersey opened their first drive-through testing facilities, well, they were run by this outfit, BioReference. They're testing tens of thousands of people per day now, and that's exactly what we need. So let's check in with Dr. Jon Cohen. He's the executive chairman of BioReference Laboratories, get a better sense of what we need in order to roll out mass testing all over America. Dr. Cohen, welcome back to Mad Money.
Thanks very much. It's great to be on.
Okay, so Dr. Cohen, tell me, what is the bottleneck here? Why are we not getting millions of people tested?
Well, Jim, there's two different types of tests. The first test, which is the COVID-19, we call PCR test, that's the one that detects the virus. And that's the one that all of us are trying to test as many people as possible within a short period of time as possible. The other kind of test is the serology antibody test that everybody's talking about, which will probably be much more helpful to get people back to work, because with that kind of test, we could test literally hundreds of thousands of people a day compared to the viral test, where we test less people than we can for the serum-based test, which is the serology test.
All right, so we've got, at one point when this started, we had Roche test, we had Thermo Fisher, now we have Abbott, BioReference. Will you fill me in where these all fit in and why I can't go up to an empty mall parking lot and just get swabbed?
Well, it's a complicated set of tests. First off, the PCR, the COVID test, is a fairly highly complex test. It's testing of the virus. What you have to do is you have to get swabbed. We have to isolate the RNA, which is the virus, out of it. We then have to load that onto an automated platform and then run the test and get it back to you. So you mentioned a bunch of the different platforms. So we're running 4 different of those platforms that you mentioned to get our volumes up to where it is of over 20,000 people a day currently. Each one of them requires a different recipe. Each one of them takes a little bit shorter or longer to run. But in the end, you get the same result. But they are different platforms, and it takes an enormous amount of staff and people to get those things running the right way 24/7. We weren't built to do this. Nobody was 5 weeks ago. We've now tested 250,000 people in the last 4 to 5 weeks on a test that we'd never had run before.
Well, do you think that we can reopen the economy with just that few number being tested, even though that is monumental given to where we were 5 weeks ago?
I think the answer is really the other test, is the antibody test. The antibody test, which will be up in the next week to several weeks, again, on some limited platforms and then on some high-performance platforms. With those platforms, we'll be able to run several 100,000 people a day. The difference is there's 2 things on the serology antibody test. One, it tells you whether or not you have immunity to the disease, we believe. It's basically like having been vaccinated. The second is we believe it'll restore confidence in people to know that they're working with a lot of people who've been exposed to the disease and now are essentially immune. So those 2 factors will have an enormous impact on getting the economy jump-started again.
Wow, that would be really fabulous. That's what we're most worried about. I mean, I see very few people who have died who are between the ages of, say, 2 and 20. Do you think they have immunity?
No, Jim, you probably know I'm a physician. Right. I'm sitting right in the epicenter of this thing in New York and Long Island. This is an incredibly serious disease, and it's almost people think it's random about who gets the disease and who dies or gets seriously ill as a result of it. There are people in their teens. There are some kids who have it now. There are some pregnant women that have it, but people in their 30s and 40s and 50s have also died. And I think the key is going to be to figure out what the genetics are of those people relative to the people who have basically no impact. Someone's going to figure that out relatively soon. It's probably related to your immune function, your ability to actually fight off the disease. But that answer is not available yet. But I would warn people that young people and people in their 30s, 40s, and 50s get this disease and can die as a result of it.
Doctor, there's been a lot of talk about vaccines, but after listening to what you're saying, I mean, we're really far away, it would seem, from a vaccine to this thing.
Yeah, I've heard what you've heard. You know, I don't know if the vaccine is 6 months away or a year away, which is why the serology antibody test could be relatively important. We just don't know how many people actually are walking around who've had the disease. We'll know that within hopefully the next 4, 6, or 8 weeks, whether or not 30% or 50% of the American population we think will actually have had the disease. That'll have a huge impact on what people think and again, their confidence to reappear in society and go back to work.
Now, you are working with a huge number of organizations, the New York State Department of Health, Health in Hospitals, State of Jersey, State of Florida, cities of Detroit, Miami. Are there more that you can do? Because obviously you are the guy that has you're doing what I think is, I mean, I read a very difficult article in Atlantic Magazine about other labs. I'm not going to mention them because it's not the point to slag, but you are the high volume guy.
Well, listen, the thing is, there's a couple of national labs. You know, we're all trying to do the best that we can. What we did is, because of our relationship with New York State and the governor of New York, Governor Cuomo, had the foresight to say we need to get testing started early. As a result of that, we did the first drive-through in New Rochelle. We did a bunch of drive-throughs after that. We're now running 40 drive-through testing facilities around the country, which includes multiple in Florida, Detroit, New York, New Jersey, New York City, et cetera. We're also running multiple testing for hospitals. We continue to run criticals for the hospitals, which are the patients who are in the hospital or in the ICU. We believe and continue to make sure that those patients get a turnaround time of 24 hours or less so that the frontline physicians, nurses, emergency medical folks, and all their staff can get that result as soon as possible to take care of those patients. So yes, we're doing the drive-throughs, we're doing the hospitals, and then we're doing first responders, and then after that, we're doing people who are symptomatic. So we're trying to actually, as you can see, we're trying to prioritize based on specific needs, but there's a huge need out there still.
All right, one last question. Let's say you're on day 2, you're not symptomatic, you're definitely going to be able to give it to other people. Can I be sure that I'm detected?
You can. If you get a COVID-19 PCR test, it'll tell you whether or not you have the virus currently or don't have the virus. If you have the virus, then you need to stay away from people, and hopefully you're not going to get too sick as a result of it. And that's where you need to shelter at home for at least 14 days before you go out and expose yourself to other people. The second part of that is eventually after you've had the disease is whether or not you test yourself for immunity to see what your immune function looks like, whether you have it's called IgG, which is immune function you may have to the disease.
All right. Dr. Cohen, thank you. Actually, you made this thing really clear for me for the first time. Thank you so much. Really appreciate it.
Thank you.
That's Dr. Jon Cohen. He's chairman of BioReference Labs. That made a lot of sense to me. Mad Money's back after the break.
Don't miss a second of Mad Money. Follow @Jim Cramer on Twitter. Have a question? Tweet Cramer. #MadTweets. Send Jim an email to madmoney@cnbc.com or give us a call at 1-800-743-CNBC. Miss something? Head to madmoney.cnbc.com.